Today we are going to talk about a predictive model of response to metoprolol in children and adolescents with postural tachycardia syndrome. The present study is designed to explore whether electrocardiogram index-based models could predict the effectiveness of metoprolol therapy in pediatric patients with postural tachycardia syndrome, that is POTS. The study consisted of a training set and an external validation set. Children and adolescents with POTS were given metoprolol treatment, and after follow-up, they were grouped into non-responders and responders depending on the efficacy of metoprolol. The difference in pre-treatment baseline ECG indicators was analyzed between the two groups in the training set. Binary logistic regression analysis was further conducted on the association between significantly different baseline variables and therapeutic efficacy. Nomogram models were established to predict therapeutic response to metoprolol. The receiver operating characteristic curve, calibration, and internal validation were used to evaluate the prediction model. The predictive ability of the model was validated in the external validation set. Talking about the results of the study, of the total 95 enrolled patients, 65 responded to metoprolol treatment and 30 failed to respond. In the responders, the maximum value of the P-wave after correction, P-wave dispersion after correction, QT interval dispersion after correction, maximum T peak to T end interval, and T peak to T end interval dispersion were prolonged, and the P-wave amplitude was increased compared with those of non-responders. In contrast, the minimum value of the P-wave duration after correction, the minimum value of the QT interval after correction, and the minimum T peak to T end interval in the responders were shorter than those in the non-responders. The above indicators were screened based on the clinical significance of the multi-collinearity analysis to construct a binary logistic regression. As a result, pre-treatment P-wave after correction, QT interval after correction, and T peak to T end interval dispersion were identified as significantly associated factors that could be combined to provide an accurate prediction of the therapeutic response to metoprolol among the study subjects, yielding good discrimination with a predictive sensitivity of 93.8%, specificity of 90%, and good calibration and corrected C index of 0.961. To conclude, a high precision predictive model was successfully developed and externally validated. It had an excellent predictive value of the therapeutic effect of metoprolol on POTS among children and adolescents.